So good afternoon, everybody. I think we have now all the speakers for today. Welcome to this event of the European Food Forum, which is really focusing on Is Food the Solutions? The Safe Earth Plan for a Better European Life. And this event is hosted by MEP Vlad Voiculescu, who is coordinator for public health for Renew Europe. We will really look at, how cardiovascular health would intersect with food and nutrition, and also assess the effectiveness of proposed policy measure to tackle diet-related non-communicable diseases. My name is Maria Teresa Scardigli. I'm the Managing Director of Kellen Europe. And today I would like to welcome all of you, all the speakers, there are many, and of course also all the attendees and those that are joining online. There will be a lot of different speakers. I will give the floor to Vlad in a second. If you have a question, please really keep it for 1 minute if you have the time. And I will try to facilitate the discussion flow, but please keep it and stay within the time limit for all the speakers, because otherwise the last 2 or 3 will not be able to speak because we only have 2 hours. And with that, I would like to thank the European Food Forum and give the floor to Vlad Voiculescu for the opening remarks.
Thank you so much. Good evening, everyone, and thank you all for being here. I was told generally that you have to start with a personal story in order to get everybody's attention. Yesterday, I had my first ever CCTA, that's coronary computer tomography angiography. Today, I just got the result, and thankfully, everything is fine. But we're going to be talking today about cardiovascular diseases. And this is obviously not abstract, not distant, and certainly not optional for neither of us. Whether we have experienced ourselves or whether we have somebody in the family or among friends, that's valid, I'm sure, for each and every one of us. Numbers, 1.7 million lives are being lost every year in the European Union due to cardiovascular diseases. And around 62 million people are affected. That's families, that's communities, workplaces, every member state without exception. If we stay on the same path, by 2050, cardiovascular disease is projected to increase by 90%. So almost double in 25 years' time. That's not such a long time. It's during our lifetime. It's also not only a health problem, a health crisis, it's also an economic one, and there's a number to that as well. And the number is around 300 billion euro that we're losing because of cardiovascular disease every year. That's productivity, that's innovation, that's human potential. These numbers tell us something very clear as my cardiologist talked to me just 2 weeks ago. This is not a problem we can afford to manage passively, but we have to prevent it actively. So this is why we're here today, and this discussion matters. So I'm very pleased to have here Commissioner Várhelyi. He accepted our invitation, and I would like to thank him once again for this. And he will share the Commission's perspective about immediately after just a few opening statements from my side. I would also like to thank the European Food Forum for co-organizing this event and for their continued and excellent work. The title of this event is very simple, is Food the Solution? And I think the evidence is very clear. While cardiovascular diseases remain the main problem, the main cause of death in Europe, 80% of these deaths are preventable. And usually it's not genetics, but it's lifestyle generally. However, if we need to put the words from the healthcare fields next to lifestyle, that's going to be prevention, and only 6% of our costs, our healthcare costs in Europe, our healthcare spending goes towards prevention. Now, These are facts, these are numbers, and this is knowledge. So it's something that we know, and it's not knowledge that we miss, but it's a policy gap. It's something that we need to do collectively. That is what policies should be about, not about quarreling only during elections. So we have a Safe Hearts plan, and this is about shifting earlier the word prevention across the life course, starting with food environments people actually live in. And we need to talk about two main sectors, I think. One is ultra-processed foods, especially those high in sugar, salt, and unhealthy fats. And we need to look at policy tools. And now one of them is simply forbidding stuff. There's a very simple reason why we are here in Europe a bit healthier still than in the United States. And that's also because some substances are simply not allowed here on this continent. And this is a good thing. Then we have instruments such as taxation. Basically, we have incentives, and we need to use incentives. Let me frame it differently. We cannot afford not using such instruments. And second, we need clear and reliable information, but that won't do it. And we're always hearing, I'm sure the commissioner agrees, we're always hearing this in this parliament and in politics in general, that we shouldn't touch people's lifestyle choices. But it's not only about that. Choices exist, but sometimes they are just on the higher end of what people can afford. If you can't afford something, it doesn't really mean that you have a choice. You only have the choices that you can afford. So we need to protect our children and our young people at a time when 1 in 3 children in the EU is already overweight or obese. We need stronger rules on harmful advertising of various products. And we need not blame individuals. It's all about shaping healthier choices by default. We need to do that through policy. We need clear targets. And that's why I welcome the fact that by 2035, the Safe Hearts Plan aims to reduce premature cardiovascular disease by 25%, and also ensure that up to 90% of citizens over 65 receive regular checks for blood pressure, cholesterol, and blood sugar. And that is all over Europe. So your postcode should not determine your heart health. That is very important. Before I give the floor to the commissioner, I would like to, on a very practical note, I would like to excuse myself that I'm going to have to step out for a couple of minutes for the Critical Medicines Act Shadows meeting, but I will be in time I will rejoin the discussions in time. And I know that the commissioner, whom again I would like to thank in advance for joining us today, will need to excuse himself as he will need to leave shortly after the intervention. And with that, Commissioner Várhelyi, thank you again for being here, and the floor is yours.
Thank you very much. Good afternoon, ladies and gentlemen. First of all, I want to thank the organizers for putting this topic on the agenda. I think this is a topic which is going to be discussed many, many times this year. And I do hope that also this year is going to be the year when we start to create new realities when it comes to addressing the underlying problem of cardiovascular health, but also its link to the problems created by highly processed food. I want to start where MEP Voiculescu has just left off, which is that still cardiovascular diseases are the single biggest cause of death in the EU. If you look at the numbers that have been quoted, we're losing 1.7 million lives. 80% of these cases could have been prevented. I think we're all familiar with the basics of the problem, as we are also familiar with the very fact that this burden is getting only heavier on us. Many of the underlying risk factors are also very clear. to all of us, smoking, vaping, diabetes, obesity, particularly among the young. Mr. Voiculescu also pointed to the very appalling numbers related to the young generation, where 1/3 of them, basically the under 30s, 1/3 of them are either overweight or obese. 20% of them are already diabetic or entering diabetes. This does not create a very impressive for the future. And yes, I can confirm to you, based on our study that we have published on the 15th of December, that most likely, if we do nothing, these figures are going to double in the next 25 years. And this is why, for us, it was an absolute urgency to come with the Safe Hearts Plan, which is our plan for a European response when it comes to cardiovascular diseases. The aim of the plan is to support the member states in preventing and managing cardiovascular diseases through very ambitious actions. Now, some of them have been mentioned. The main target that we have in mind is to bring down premature cardiovascular-related death by 25% by 2035. Just to put this into perspective, if we were able to eradicate 100% of the early death related to cardiovascular health, we could expand the life expectancy of all Europeans by 8 years. 8 years. So what we try to achieve is to give back to the Europeans at least 2 years of their lives, which they're losing unnecessarily. And this is why we have 3 main focus areas: prevention, early detection and screening, and of course, treatment and care. The plan has 10 flagship initiatives that cover all these areas. They also look at data and digitalization, research and health inequalities, because these are the main tools through which we can really start to create a difference. I would start with prevention. For me, also personally, prevention is the most important part of the Safe Hearts Plan, and maybe this is the novelty and the whole plan. Because in order to better prevent cardiovascular diseases, we will need to continue to support member states to address the main risk factors, and that should include also promoting healthy diets and better heart health. We currently have a joint action which is called Prevent NCD, where the member states are working together to address the health determinants, including healthy diets. We're funding 76 million euros from the EU4Health program only to this. Under the Safe Hearts Plan, the flagship initiative EU Cares for Your Heart will build on this work and will further expand it. New digital tools. The main risk factors, of course, include hypertension as a primary risk factor, uncontrolled cholesterol, diabetes, and obesity. They also include nicotine use and tobacco, physical inactivity, harmful use of alcohol, and food intake. To address these things, we need to look at the root causes deep down. Nearly 80% of these diseases could be prevented, as it was already mentioned. So prevention could be by far the most cost-effective investment as well. Yet what we see, it receives only 3% of the total healthcare spending in the European Union. Why not? All these risk factors are related to what we eat and drink. Many of them, if not most of them, are. Because diet is one of the key risk factors that we can actually change or help people to change it themselves. Healthy eating habits are key if we want to avoid ill health and if we want to promote well-being and healthy living years. This means eating enough fruits, vegetables every day, as we all know from childhood. Still, we don't do it. And staying within the recommended levels of energy, saturated fat, sugar, and salt. These have a major impact on body weight, blood cholesterol, blood pressure. And in the Safe Hearts plan, we want to create a solution and also the choice for Europeans to make a difference for themselves. We will continue with the successful initiatives that are already in place, and we will also launch new actions in this area. For example, the Commission already supports local governments in ensuring that healthy foods are served in public institutions like schools, hospitals, and other government facilities. And for this to happen, of course, public procurement relies on criteria being followed by the food service providers. The Joint Research Center has recently published a report on the criteria for sustainable public procurement for food, catering services, and also for vending machines. This is intended to support all those launching procurements these days at public, in the public sphere, especially at local government. Another example I could mention is the EU school scheme for fruits, vegetables, and milk products. Schools and other educational institutions can significantly influence the children's and the young people's eating habits through both education and by providing healthy food choices at place. The Commission has completed a review of this scheme, and we propose to continue it beyond 2027, so in the next multi-annual financial framework period as well. Because there is a very definite need to provide clear, evidence-based information about food to people. By making people more aware of the nutrition options available, we should be able to help them to make their own choices. There is overwhelming evidence linking a high intake of ultra-processed food with high sugar, fat, and salt content with the risk of developing obesity, diabetes, and a range of metabolic diseases. Take just last year's series of studies published by Lancet that leaves no doubt about the impact of highly processed food on cardiovascular health. We, as the Commission, have asked the Scientific Advisory Mechanism and also the European Group of Ethics to issue opinions about the impact of this food on our health. In addition, it was announced in the Vision for Agriculture and Food that we will launch a study on the impact of the consumption of ultra-processed foods on Europeans. And then, based on the outcome of this work still this year, we will look at which tools could be used to support and fund health actions in the field of primary prevention. But definitely, under the Safe Hearts plan, I want to initiate action and go beyond the usual exchange of good practice approach. Therefore, we will work on a new comprehensive food processing assessment system to empower the consumers with transparent, accessible, science-based digital information on food processing and specific food products. This will aim to ultimately encourage shifts towards healthier diets without increasing costs for the consumers. But we will not stop here. Based on the outcome of the study on ultra-processed foods, we will move forward with other tools, including possible financial actions or incentives that can fund public health actions and stimulate food reformulation and healthier consumer choices. So I'm pleased to follow today's exchanges about the initiatives we urgently need in order to promote the healthier diets. And I want to be very clear. Addressing cardiovascular diseases across our union is not an easy task, and it is no small undertaking. We're fully aware. We have an aging population. Our health systems are under very heavy pressure, and our society is seeing lots of change. But the problem will only get worse if we don't act. The Safe Hearts Plan is the first step on this path, and it will act on food as well, because food is part of the solution. I look forward, of course, working very closely with this House, with you, as well as the member states, the stakeholders, including health professionals and patient organizations in this important area. And I also count on the support of industry helping to reformulate food so that we can continue to supply our consumers with the healthiest option always. So we want to count on your help to make the Safe Hearts Plan a reality across this union. And I think this is one of the very first actions that we feel that needs not only attention, but great devotion also from this circle. Thank you very much.
Thank you.
Thank you very much, Commissioner Varela. Fantastic. I have a question, actually, if you have one more second. And I received a question in relation to, could you explain actually how the Safe Health Plan would ensure that food and nutrition policy are guided by the scientific evidence? Fiscal measures are actually demonstrating that improve health, and then that industry is seen as a partner in support of this approach across Europe.
Oh, that would take another 15 minutes to respond, but I try to make it
One
quick.
short one. Thank you.
First of all, what we see is, if you look at the Lancet report, I think it's also easy to read because it's very straightforward. What you see is that the damage is already there, and there is no question where the damage is coming from, especially if you look at the young generation. But we also see that with the evolution of technology, we have now tools that are capable of measuring the actual impact on the body at an individual level of very specific food products. And those are based on biomedical science and on the map of the human genome and on the list of ingredients as provided by the producers. And what we see is that in at least one country where it works already, what we see is that this gives, first of all, an informed choice for the consumer. It does not take away the choice of eating what you like, but it gives you a real view of what you are picking when you buy something. And it gives you also a very clear idea what is going to be the impact on your body when you pick this or that product. And this does not exist in Europe. There are very many applications, but if I go back to the roots of all of them, almost all of them are related to one or another company. So they always are, how should I put it? They're not free from economic interests. But what we need is a clear choice for the consumers. This is a tool to measure. Now, we need most probably also a tool to influence the choice. But when we do that, of course, we don't want to tell people what to eat. We don't want to ban people from eating what they like, but they should know when they buy something that it creates damage. You know, if you want me to give you an example, 10, 15 years ago, everybody took it for granted that if you go skiing and you break your leg, then the helicopter will come and pick you up on the top of the mountain for free because you are covered by the health insurance. It's not the case anymore. It's not the case anymore because it's an extra risk that the society might not want to cover for you. So if you take extra risks, you should have extra insurance. This is the logic behind an introduction of a micro levy that does not take away the choice of buying the stuff still and not affecting fundamentally the price of the product, but that could create an incentive for you to know as consumer that the choice you made has a health impact, a negative health impact. And on the other hand, for me, that is equally important, if not more important, to give an incentive for the producer to change the composition. In at least one country, they have started in a big country, an ocean away from us. They have started to change the composition of the products. And what we see is that prices are not changing. What we see is that you can actually produce healthier choices for the consumers at the exact same price without creating the health damage. And this is what I think we need to achieve. I know all the debates about it, that, you know, if you start to impose these taxes, you're going to be taxing the people with the less financial means. But this is not taxation, and this is not about punishing the consumer for the choice, but pushing the industry to change the composition. Because the health impact should be that we will have less and less products that are capable of building up the generations that we see emerging also in Europe. But if you look at the UK, if you look at the US figures, you can see where we are headed in 5 or 10 years from now if we do nothing. Thank you.
Thank you very much. Thank you again. I would also like to welcome MEP Stefan Köhler to this event. Thank you very much for being here. I don't know if you have 1 more minute, if you want to say something, otherwise.
I'm just on my way to my next appointment. Sorry about that.
Okay.
But thank you for being here with us before. So without further ado, I would like to start with the first panel after this session with the MEP and the Commissioner. The first panel really focused on scientific and academic insight, evidence on nutrition and cardiovascular prevention, clarifying the risk and the opportunity. And we have with us Professor Adam Drionowski. He is actually online from the US. Thank you very much, Adam, for joining us. I hope you can hear us. I can see you smiling. Adam is professor of epidemiology at the University of Washington in the US. So Adam, the floor is yours. Please go ahead.
Thank you so much. I want to thank European Food Forum for inviting me to give this very brief presentation on social disparities, diet quality, and cost. I'm actually in Seattle, where the day is just beginning, and Seattle, as you know, is famous for 3 things: Microsoft, Amazon, and rain. But let me go on to the next slide, which shows you a map of cardiovascular disease mortality in European countries. And here you look at the social disparities by region, by country, and by region. With a name like Drewnovski, I'm of course from Warsaw, Poland. You can see here Województwo Mazowieckie and Warszawa, which is where I'm from, an island of lower prevalence mortality than the surrounding areas in Poland and in Eastern Europe. But this is a map at a gigantic scale. Let me take you to a micro scale and deal with data in Seattle at the level of individual households. Let's take a look at the next slide. The next slide shows you data for Seattle. On the left is a map of Seattle. The white area is Pacific Ocean on the left, Lake Washington in the middle, and the rich areas are shown in deep, deep green. You can pretty much figure out where Bill Gates lives. It's in one of the green areas. The map on the left represents property values at the tax parcel level. And this is the value of homes. Obviously, homes on the waterfront are more expensive than the homes by the freeway. This is the contrast between the brown freeway and the industrial area and the expensive areas on the waterfront. Go to this panel on the right, which shows you deciles of property values and body mass index. Take a look at what happens when you go from the bottom decile of property values to the top decile of property values. Obesity disappears. This is more significant for women than for men, but it works for men as well. And I can tell you also that we see the same result for children age 5. The body mass index of children at the age of 5 depends on the property value of their parents' home. So socioeconomic factors are extremely, extremely important. The data on the right are based on 200,000 patients and medical records, which were all geolocated and geocoded by home address. So we were able to use those data to micro-simulate obesity by census block in Seattle. As I said, a micro scale. Each census block has about 1,000 people. So this is not a map at the level of a country or a region, it's a map at the level of neighborhood. And we pick up differences in obesity rates between the rich and poor areas, which are really sixfold, even though Seattle King County is a very healthy county on the average. And you can see where obesity is concentrated. It is not in the rich areas on the waterfront. The question, of course, is, what does diet have to do with it? So let's go on to the next slide. And the next slide shows that what people eat depends on where they live. So on the left, you see the frequency of soda consumption, the same map. And then you see the frequency of salad consumption in the middle in green. And then you see measure of compliance with dietary guidelines in the middle, the healthy eating index. So I want to make the point here that eating habits depend on where you live. Is living in a $5 million home a lifestyle choice? Maybe. You tell me. Is selecting healthy food a choice? Yes, it is to a degree, but diet quality increases with property values, and also percent energy from highly processed foods depends on incomes and education and the cost of the diet and property values. And the unfortunate thing is that healthier foods cost more. Let me go on to the next slide and show you now the difference in energy density and nutrient density of different foods. This is a slide from some time ago. I still use it to show there's no such thing as a dichotomy between good foods and bad foods. Bad foods to the left, good foods to the right. Notice that foods on the left top are energy dense. Foods on the bottom right are low in energy density and high in nutrients. There's a nutrient density score which captures not only calories, fat, sugar, and salt, but it also captures nutrients, protein, fiber, vitamins, and minerals. So the one thing to remember from this slide is this. It's a continuum. Not every fruit and not every vegetable is of equal energy density. Not every processed food is nutrient poor. For example, you see on the right grains, and those are ready-to-eat fortified cereals with fortification. Then you see at the top nuts and seeds, high energy density, high nutrient density. Just to remind you, energy density on the vertical axis, for those of you who have no training in nutrition, energy density goes from 0, water, to 4, sugar, to 9 calories per gram, 900 calories per 100 grams, that's fat. And the nutrient density is essentially nutrients per calorie. Nutrient-rich foods have more nutrients than calories. Foods that are nutrient poor have more energy than nutrients. But let's take a look.
I'm sorry to interrupt. I mean, I can only give you 1 minute because you are running out of time. Thank you.
Very good. So let me just make the big point about Cost is a fundamental point. Next slide. The next slide tells you about cost. Foods which are nutrient rich are expensive. Foods that are nutrient poor are cheap. This is a logarithmic scale, which means the difference is phenomenal. Let's go on to the next slide, which brings it to you in greater perspective. We always forget about that in dietary guidelines, which feature expensive foods, salmon, asparagus, grains, and so on. Let's move on to the next slide. The disparity in cost is in fact huge. Let's move on to the next slide. This is the disparity. So is it a lifestyle choice? Maybe. Is it reasonable to get people to move from foods on the left towards foods to the right? Possible. Will taxation take care of it? I don't think so. Let's move on to the last slide. I've got some ideas about research. And let's go on to the next slide. And research would suggest that affordable, healthy foods are the solution, but the main barrier are food prices and diet costs. And what you need here in Europe are dietary intake data of representative samples, geolocated data on diet quality and health, and then national food prices, open access file of national food prices. We don't have that, so we don't know what those foods will cost. The local and regional food databases are absolutely important. And I finish here. Thank you so much.
Thank you very much, Adam. Thanks a lot. Very interesting presentation. The second speaker today, Rosalinda Scalia, she has not arrived yet. I hope she will come. She has been retained in the Berliamont. So maybe we could have it afterwards. And with that, Adam, thank you again. Much appreciated. I would, if you could stay a little bit longer, maybe we can take all the questions at the end of the different panel. That's maybe easier. Thank you very much.
Okay. Thank you.
Thank you. Our next panel is actually the second panel on economic impact and taxation. And we have three speakers, Eleftheria Psaraki, who is Deputy Head of Unit for Behavioral Taxation and Other Indirect Tax at the DG Taxud at the European Commission. And then we have Adam Hofer, who is Director of Excise Tax Policy at the Tax Foundation Europe. And then our third speaker is Dan Manolescu, Tax Partner at Soter and Partners. Please, Eleftheria, the floor is yours.
Thank you very much. And thank you very much for inviting me. Good evening, everybody. I have a PowerPoint presentation. I don't know if we can see the first slide. Perfect. So today's event is entitled Is Food the Solution? But I will rather focus on is food taxation the solution in my presentation? And can it really improve our health? Next slide, please. Let's start with an alarming graph. According to the 2025 World Obesity Atlas, as you can see, on average, 24 of the adults in the EU are obese. The EU average here is the average on the rates in the 27 member states. It is not population weighted. Based on present trends, overweight and obesity will affect nearly 3 billion adults globally by 2030, and that is around 50% of the world's adult population. Next slide, please. I'm going to focus on two of the policies that can promote healthy diets and physical activity. The first is taxation on high-fat, sugar and salt foods, and the second is taxation on sugar-sweetened beverages. As you may know, there is a general academic consensus that the overconsumption of HFSS and SSB products is linked with negative health effects. Next slide, please. SSB taxes are a commonly used fiscal policy. Most of them are excise taxes, but not all. As you can see on the global map, the taxes in light and dark blue are excise taxes. There is strong evidence that SSB taxes increase prices, reduce sales, and stimulate product reformulation, as the Commissioner also mentioned earlier. Next slide, please. DigiTaxud has commissioned an external study on the design, implementation, and impact on public health of HFSS taxes in the EU to provide a foundation for discussions with EU member states. The study was published in 2025, in May 2025, and you may find it on the website of Taxud. You may see that 13 out of 27 member states tax SSBs. 2 tax HFSS foods. The most common form of HFSS taxes across member states is specific volume-based excise duties on SSBs. This means that the tax is based on the quantity or volume of the tax product, for example, per piece, per liter, or per kilogram. Next slide, please. Here, you can see that out of 13 member states that tax SSBs, 12 use excise duties and 1 uses VAT. Next slide, please. Of the 12 member states that apply an excise tax to SSBs, 11 use a tiered structure, while 1 uses a uniform rate. Tiered structure means that the tax is in tiers. For example, the tax rate depends on the quality of sugar per liter. The uniform rate obviously means that one rate applies to all SSBs, regardless of the quantity of sugar. Next slide, please. The main exemptions from SSB taxation are milk products and sweetened or unsweetened fruit juices and bottled water. Next slide, please. Currently, member states address key design features for SSB taxation individually, but the EU has tried to address the issue via the Europe's Beating Cancer Plan, the Farm to Fork strategy, and the Safe Hearts Plan that was recently published and for which Commissioner spoke a while ago. The question is, could the development of harmonized rules on HFSS taxation achieve desired public health and fiscal objectives while securing the proper functioning of the internal market? What did our study conclude? The study concluded that HFSS taxes are a potentially effective policy instrument to improve the health of European citizens. The key observations are the following. Behavioral taxes can play a significant role in the policy mix to promote more sustainable choices by both consumers and industry. Well-designed SSB taxes can lead to price increases, which depress consumer demand and stimulate product reformulation. Thoughtful design with an appropriate number of tiers and threshold levels can shape how industry will reformulate the products. Health benefits and changes in healthcare costs are associated in a reduction of body mass index. Beneficial health effects are expected to be stronger for the lower income households in most member states. And last, taxation should not be viewed in isolation, but must be part of the broader political agenda, especially in the field of health. So to go back to my initial question, yes, food taxation could be one of the solutions for better health. Thank you very much for your attention.
Thank you. Thank you very much, Eleftheria. Much appreciated. And then I would like to see if Adam The floor is Adam. Can you hear us? Yes, I can see you there. So Adam Offer, Director of Excise Tax Policy at the Tax Foundation Europe. Again, he is from the US, so he's online. Adam, the floor is yours.
Thank you.
Yeah, Adam Offer, yeah.
Thank you for the opportunity to present today. I also have a few PowerPoint slides. We could pull those up whenever you have a chance. I'm also going to be talking about food taxation. I work for the Tax Foundation, which, as our name suggests, we really focus on taxes. And it is sugar-sweetened beverage taxes that bring me to you today. At the Tax Foundation, we have explored the effects of sugar-sweetened beverage taxes. And like our previous presenter, I think we have a lot in common for what we think about what sugar-sweetened beverage taxes can do, but I think we reach a different conclusion on their overall ability to impact and improve public health. The title of my slide here, sugar-sweetened beverage taxes alone won't fix global health. I think it is a really important issue to discuss here when we talk about these taxes and their ability to affect broad public health measures such as obesity, sugar consumption, and body mass index. What we find when we study the academic literature is that the sugar-sweetened beverage taxes do not seem to either have no effect or they seem to have very little effect on any of these broad public health measures that we study. Next slide, please. So whenever we look at sugar-sweetened beverage taxes, what we developed here is something that I like to call the pathology of sugar-sweetened beverage taxes. That is, we ask the question, what would it take for a tax, a food tax in particular, to improve public health? All right, so we get from the policy all the way down to step 4. Step 4 being we see cumulative behavioral changes and public health improves. So I'll go through each one of these steps briefly. So if a tax is going to improve public health, what has to happen? Well, first, the tax actually has to translate into some sort of market effect. That is, a tax is applied on a product and that tax increases market price. Now, we have lots of academic literature here that says that happens, right? The average effect is somewhere around 82%. So for a $1 tax, that will increase the price of a product by roughly 82 cents. Estimates are fairly wide-ranging, but anywhere from 68 to 95% pass-through rates. So taxes do increase prices. Now, step 2, do higher prices reduce consumption? My background is as an economist. This is what we call Econ 101. If prices go up, of course, consumers are going to consume less. The academic estimates put this effect somewhere around a 10% price increase, translating to a 5 to 10% decrease in consumption. Now, this is where the overwhelming majority of the academic literature lies, and I think there's a consensus around these findings. Taxes increase prices, prices reduce consumption. Now, I think where we start entering some problematic territory for the ultimate goal of improving public health is this third tier, this third number 3 point here on our pathology of improving public health here, and that is that after some consumers reduce their consumption, the rest of their behavior needs to include things that lead to an improvement of public health. All right. Now, I think that there's a default assumption that consumers of sugary sweetened beverages, if they drink less of that, will just switch to water and then change their behavior, their activity pattern, not whatsoever. right? That would lead to, all things considered, less caloric consumption, the same amount of caloric expenditure, and that would decrease weight. But the problem is that that's not what we find in the literature. This is exceptionally difficult to study, studying every single thing that consumers would switch to if they drink less. What we have seen is that children in particular like to switch to, if they stop drinking sugar-sweetened beverages, maybe they switch to something like chocolate milk. We have academic evidence that suggests adults will switch to consuming more beer if they drink less soda. And so this is where the water gets really murky and muddy. It's challenging to tell how consumers are going to respond in the face of a tax and a behavior change, even if they do drink less soda. And the results, next slide, please. My final slide is that when we look at the population numbers and even the data among people who do switch to consuming less sugar-sweetened beverages, we don't find changes to the important public health measures that we're studying. The empirical evidence consistently finds no evidence of body mass index reductions or decreases in obesity. And my final point, because I'm a tax guy, I also have to mention the other side of taxes here. Taxes generate revenue, but as a revenue generating source, sugar-sweetened beverage taxes are generally not very well suited for raising funds for public health programs. They generate revenue that is not very stable. It changes from year to year as consumption patterns change. And these are also, as has been mentioned several times, consumed more heavily by lower income populations. So these taxes are not a great source of equitable revenue. Thank you for the time.
Thank you very much, Adam. Thank you for your presentation. And then the last speaker for this session is actually Dan Manolescu. He's the tax partner at Soter and Partner. Thank you, Dan.
So hello, good evening, everybody. I'll start with a question that all of us are familiar with. So the question is to be or not to be. But an equally important question, especially that we are in a food forum, is to taste or not to taste. Because probably out of the core 5 senses that us humans have, the one that shaped humanity the most are leaving aside the sense of sight, seeing, hearing, smelling. The other two, the sense of taste and the sense of touch, are probably the one that created the world that we are living in. Why? Because with the sense of touch, the preference to choose silk and cotton versus sheep wool defined the way Europe expanded. The preference for spices and going even further back, the preference for salts also defined the way the world looked at the time, the way different parts of the world interacted between themselves. So we have the spices that shaped the first millennia. Then we had after the 1500s, this need for spices generated the development of the new trade routes, which finally end up discovering a new continent, which ended up creating a new, let's say, type of spice, which is the sugar, that again generated empires, collapsed empires, moved population from one continent to another, and created, as I said, the world that we are living in. Again, the cotton was the one that generated the industry era that was probably the generator of, again, the world that we see today. So all these changes were generated by 2 senses, which are the most important for our discussion today. And I would focus on the sense of taste because this creates preferences. The preferences generate demands. The demand, of course, we all know, generate an offer, which means industry and trades. this development in industry and trade generates money. And once money is there, there is the clear desired and, of course, need of the tax to tax this money and to obtain income for the budget. From this story, I will remind you again of the famous saying of Jean-Baptiste Colbert in the 16th century, who was the treasurer of Louis XIV, who said that the art of taxation is to pluck a goose so that to get as many feathers with the least amount of hissing possible. So to take as many feathers you can with the least amount of noise. That would be the ideal taxation. And jumping 3 centuries forwards, we have the famous Lafar curve, which is saying that somehow there should be an optimal level of taxation, which is reaching, let's say, a point where the taxation system is able to collect money from a certain activity or consumption so that it's reaching a balance between what it's generating in terms of incentives and what it's collecting for the budget. Now, because we are discussing about taxing on foods, I don't think that only taxation, as it was mentioned before, is the solution, because it could be part of a solution, but we have to make sure that we are not overreaching, because taxes on this kind of things, salts, because it was a tax on salt as well. It was a tax on spices as well. It was a tax on tea as well. And we all know how this ended up with the Boston outcome. And so all these kind of things generated not only money for some points, but also problems. So we have to be very careful in terms of the way we are using taxation, because although taxation could be a tool, is not a Swiss knife, is not a tool to every problems in the world. So somehow we need to make sure that any type of taxes we design, we reach the objectives that we want to reach, because it might be that trying to tax some foods, some type of foods, some types of beverages, we are only creating problems for those population which really have a sweet tooth, because we all have to a certain degree a salt tooth, a spicy tooth, a sweet tooth, which is not in our mouth, it's in our brain. So somehow this has to be addressed, especially by education, especially by making people aware of what is happening, and not by somehow punishing, by increasing prices, or by creating a system which is just taking their money from their pocket. Because if you put the pocket to fight the brain, the pocket will always lose, because this is how we have addictions. This is how we seen already people going bankrupt because of addictions, because always the brain is more powerful than the pocket. So I don't think targeting the pockets is the solution. Targeting the brain should be the aim. Thank you.
Thank you very much, Dan. Thank you for your intervention. And with that, we close the second session. And I think I think the best would be to have all the questions at the end. I'm sorry for those who have already spoken that we need to say, like the two Adams that we have online. But I think, for the timing, keeping the timing, it's easier. So, and without further delay, I would like to give the floor to, on my left, to Professor Carlos González das Neves, Chief Scientist of EFSA, and he would really introduce the third panel, which is the multi-stakeholders dialogue on the food supply chain and policy. Please, Carlo, the floor is yours.
Thank you very much. And let's hope I can open the door for some discussions, but so that's why I'll be a little provocative. But so first of all, MEP Voiculescu and dear colleagues, scientists, policymaker, dear friends. We are gathered here today because we stand at a crossroads, and we've heard the numbers. So the 1.2, the 62 million, the 280 million euros of economic losses. The question is perhaps not anymore whether we can afford to act. The question is really, can we actually afford not to act? And I don't think that's a question it's difficult to answer. But it brings us to a powerful idea that is, I believe, at the heart of this new EU Safe Hearts plan, and it's what brings us here today. Is food part of the solution? Spoiler alert to the end of my intervention, yes. But let's go a little deeper and be a little more provocative. Food is part of the solution if it's backed by science, if it's protected by safety, and if it's guided by evidence rather than fiction. For decades, Europe has built one of the strongest, perhaps the strongest, food safety systems in the world. EFSA and many partners across all member states make sure that European citizens trust that their food is safe. But many citizens are now asking, and it's a fair question, safe, okay, but is it healthy? Now, the role of defining what is a healthy diet and the consumption patterns belongs to the member states' authority, the policymakers, and I respect the remits of decision-making. But this new plan makes a transition from the simply preventing to a really long-term optimization of vascular health. So I suppose it forces member states and other stakeholders to agree that food, healthy diets, consumption patterns will have to play an increased role in this discussion. Safe Parts plan tells that we need better diets. So here, let me tell you that from the EFSA side, we hope to provide scientific advice that helps define what better diet means. Let me quickly illustrate. EFSA has provided scientific assessments, dietary reference values that show, for example, cardiovascular risks of saturated and trans fats, excessive sugar intake. And these opinions have guided public policies, but they can help influence both product innovation, as the Commission mentioned, product reformulation in the food sector. Under the EU Nutrition and Health Claims regulation in place, there are health claims related to cardiovascular health. EFSA has given positive opinions on claims, for example, on barley beta-glucans, on plant sterols. These opinions support the cause and effect relationship, in this case, between consumption and lowering blood LDL cholesterol. This protects consumers, and it ensures that the dietary prevention is built on evidence, not on fiction, and not on TikTok quick videos. And lastly, Europe is also investing in research and innovation in biotech, and we ensure that novel foods entering the European market are safe, nutritiously appropriate, and beneficial rather than harmful. It's not all about just what is good in foods. We should also think about stressors. And I would only highlight that through the work, for example, of the contaminant panels, scientists supporting us have identified environmental stresses like lead, which contributes to hypertension, cadmium, which drives vascular inflammation. And these are critical points also in the decisions and deliberations we take. We should not think that a healthy heart diet can be achieved if compromised by toxicological risks like this. So my point here is that safety and nutrition, they can't live separate. They are actually two sides of the same heart. Now, the plan is ambitious, and we hope that we can support it as well. I've mentioned the substantiate innovation when we support health claims, when we support novel foods introduction in the market. And you may be aware that under the current proposal for the Biotech Act, an expansion of EFSA's mandate is foreseen in the realm of nutrition. We're not yet aware of how that will sort itself out. It's at the table here in this house for discussion. But it may provide us the possibility to advise further on nutritional properties of food products and help us to tackle the rising prevalence of these diseases. However, ladies and gentlemen, let me also say that despite the progresses, we have significant gaps, and these need to be collectively addressed. Inspired on the plan, let me just mention three. The famous gut-heart axis. Emerging research shows that diets shape microbiome, microbiome impacts the heart and its health. We continue to need to deepen the understanding of microbiome. The capacity of regulatory agencies to infer conclusions linked to the microbiome remains extremely reduced, not to say absent, in Europe, in the US, in Japan, in Australia, wherever you want to go. Science in this topic is moving, the discovery is moving at the speed of light, but translating this knowledge into regulation and to regulatory use, that's moving a little slower, a little at a speed of a Brussels train in a strike day. So secondly, when the Commissioner has mentioned it, I won't go too much into it, the comprehensive food processing assessments and the famous topic of ultra-processed foods. And I would also highlight that on top of scientific knowledge on this cause and effects, we actually do not have, from a regulatory point of view, even a framework to define exactly what an UPF is. And last but not least, especially definitely not least these days, science is more and more about data and AI. We continue to develop open access databases on food consumption, environmental footprint linked to the consumption database of the Union. This can only be done with the support of member states and many other stakeholders across this room and probably across the food chain. If don't team up, we will not get it done. So in conclusion, ladies and gentlemen, the message is simple, but in the world we live, perhaps it's not given for granted. Science must lead, and we must unite. Food safety and cardiovascular health can no longer live in these separate worlds. And here, this One Health approach, the capacity to bridge together regulators, scientists, policymakers, this can make a difference. Our citizens demand transparency, they deserve trust. This should keep us motivated and energized. With this, we can ensure that the foods that are on the table have gone to the toughest scientific scrutiny in the world. And this is our responsibility, this is our strength. So as EFSA chief scientist, I may be biased, but is food part of the solution? Yes, it is probably the most effective and powerful tool we have available. If we invest in science, close the gaps, bridge the silos, we can ensure that every European citizen has access to foods that supports not only a healthy body, but also a healthy heart. Let's be passionate about this endeavor. Let's love it. And I understand, MEP Voiculescu, that in Romanian about foods, you have a proverb that goes, Dragostea trece prin stomach. Love passes through the stomach. But as you all well know, love comes from a healthy heart. Thank you very much. Mulțumesc.
Thank you very much, Carlos. I love your Romanian, actually, accent. So no, thank you so much. Maybe I know that Rosalinda Scalia has just joined us, so thank you very much for that. And maybe I was thinking that I could give you the floor right now, and then we will go once with all the stakeholders. So as a reminder, Rosalinda Scalia is Deputy Head of Unit for Bioeconomy and Food System at the DG Research and Innovation at the European Commission. And she was supposed to speak together with Adam at the beginning on the panel number 1, Scientific and Academic Insight. Rosalinda, the floor is yours.
Thank you so much, and a pleasure. I was supposed to speak after one scientist, but then I spoke after the other scientist. So always a honor and pleasure to be here with you or to discuss food and the implications of food. To be honest, my role here is kind of a neutral broker because, as you know, the Safe Heart Plan has been published recently, and my colleagues from DG Santé have worked on that. So this document has gone through the normal internal consultation of the Commission, and now is with you. So with everything that also the stakeholder can do with it, and all the attention that food has in this framework. And I wanted to tell you just about the consistency of recent policy initiatives, just to understand where the attention from to ultra-processed food or to the study that will be done on the so-called ultra-processed food, where it came from. The first time that this study was mentioned was the 19th of February last year in 2025, when the EU Vision for Agriculture and Food announced that such a study was going to be done, and that this was going to feed the discussions on the food dialogues. For the first time, the Commission announced that a food dialogue with all the actors of the food systems was going to be put in place. Then the 5th of July, always of last year in 2025, we developed our thinking inside the Commission services, and a more detailed reference to this study was included in the life science strategy. So in the life science strategy, you can see that this study will be carried out by the SAM, the scientific advice mechanism, also with paying attention to the ethic components. So that was a kind of expanding this reference to the study on so-called ultra-processed food. And this brought us to December, when the Safe Heart Plan was published. And also there you can see a broader reference, because the result of this study then will be used to feed the discussions under the food dialogue. So in a way, there is consistency in this approach, and now we are ready to act. My colleagues in DG, in the Directorate General for Research and Innovation, those colleagues that deal with the SAM, with scientific advice mechanism, and with the group of ethics, they have already started to put in place a framework to discuss with all the Commission relevant services, and with the aim to produce a scoping paper that will be the basis for this study. So the SAM itself has not started to work on it, but the machine has been put in place, and we are really happy to be contributing to this process, because, as I said at the beginning, my neutral approach is to have clarity on what we intend for ultra-processed food, is to go beyond the divisions that we have seen already in civil society on whether something is good or something is bad. We should go beyond this kind of approach, this divisive approach, and really be science-based. For what do we need process when we process food? We need process to make perishable food resistant to available to everyone. We also process food that needs to address certain needs, specific nutritional needs for people who are gluten intolerant, for people who have different allergies. So we have to be open when we approach this discussion, and not only think that from one side we have the stick that is good and that is healthy, and from the other side we have just a donut that is high, of course, in salts and sugars. That we all know. We need to go beyond that approach and to use science for this kind of discussions. So my intervention was meant in these lines, and I hope that you had already very good discussion at the beginning with your distinguished guests. And I also hope to follow the discussion of the stakeholders later on. Thank you so much.
Thank you so much. Thank you, Rosalinda. Thanks a lot. And now I think we can go to the panel number 3, which is the multi-stakeholders dialogue on the food supply chain and policy. We have 6 speakers, so really appreciate if you stick to between 4 and 5 minutes. So at the end, we can take all the questions for all the different speakers and start to have a dialogue. So the first one is Eduardo Cuoco, Director of IFOAM Organic Europe, which is the umbrella organization for organic food and farming. Please go ahead.
Thank you, Maria Teresa, and thank you to the organizer who invited me to this event. I'm very happy to be with you today to talk about, is food the solution for cardiovascular disease? Indeed, food is one of the components that can be a solution for that. And for me, it's important to understand which kind of policy tool can really deliver results when we talk about food as part of the solution. And we'll listen to taxation as one of these tools. We know there are a lot of information campaign around that, but we do believe as IFOAM Organics Europe, that's very important to understand the surrounding of food environment. How we can make, a surrounding food environment that supports healthy choices. And I think what Professor Drewalski said is very relevant. Healthy food is often less accessible and more expensive. And information alone in this case is very limited. Yeah, that's why over the years as organic sector, we've been working on a strategic approach. How can we make possible for all in a democratic way to have access to healthy food? We started thinking about schools as a particularly strategic tool. And I'm very glad to have Rosalinda with us, because it's thanks to a project that has been financed by the GRTD that we have the chance to work with more than 600,000 pupils in 3,000 different schools in 12 different countries. And we started with them to work on how food meal can make a change. The project was called School Meal for Change, School Food for Change. And it was not only about substituting organic products with conventional products. That's not the point. The point is really to make sure that there is a conversion into the thinking how food catering should be managed into public procurement. So we've been working with more seasonal food, less highly processed food, better meal quality overall. We've been training kitchen staff. We've been making food education linked to their daily meal, you know, with the pupils. So children had the possibility to learn by eating, not just by listening, by being informed about that. We could see that this approach delivered really good short-term improvement, but also long-term behavioral changes. So let's say public procurement is one of those policies that can really create an impact. This is something that can be decided in this house. No one else has to decide about that. It's the politics who decide about public procurement. This is a powerful tool you have in your hand. Let me just say that in Denmark, where we worked a lot on public procurement the last years, we reached about 90% of organic consumption in public canteens. It's not about organic as a label. It's because organic trigger a different diet habit. I mean, organic consumer normally eat more seasonal food, fresh ingredient, less processed food. This automatically gets to better diets and lower risk. And from an economic point of view, the data from the Danish government talks about 1.6 billion cost savings since they made the switch to this kind of public procurement approach. 300 euro for citizen was saved on health-related cost. For each euro invested in good public procurement, so in healthy diet, lifestyle, and organic in this specific case, they had a return on investment of 35 euros in a health cost saving. So even the number, we started this event talking about the cost, the economic cost of about 200 billion euro per year. Denmark is showing us that with good public procurement, we can really achieve also not only prevention, not only a healthy diet, but also we can have better economic management of our resources. So I will close to say the Safe Health Plan offers a strong framework. So it's there. We need to capitalize on that. But the impact will really depend on moving beyond information campaign alone, moving beyond taxation alone. We need really a good holistic approach to this issue. We need to invest in food environment. We need to invest in access to education, which is essential for our future. So that's what I would like to say for now. Thank you very much again for my invitation. Thank you.
Thank you, Eduardo. Our next speaker is Sara La Monaca, Director for Consumers Information, Nutrition and Health at Food in Europe. Please go ahead.
Thank you, Maria Teresa. I want to thank the European Food Forum and MEP Voiculescu for organizing this event for the invitation. So as has been said already by several speakers before, cardiovascular diseases remains a serious public health challenge in Europe, and focus on prevention that brings the cardiovascular health plan. It's something that it's needed, and it's also something that it's welcome. From the food and drink industry perspective, of course, there is no debate about one thing, that diets and nutrition, they matter. And it's important, so prevention, because prevention has to start long before people enter the health system. So the key question is not whether nutrition and food should play a role, but the question is how do we design policies that work? So first, what work? There is no single policy measure that will deliver results on its own. It's always a combination of policy measures. Of course, in this regard, the actors that play along the supply chain, they all have a role to play. And I always like to recall a very successful example of a combination of actions undertaken by different stakeholders in the supply chain, so including food industry, catering sector, but then also with the participation and active involvement also of the NGO, so civil society, academia, and public health authorities. And I'm referring to the Danish whole grain partnership that delivered incredible results in the objective that they had of increasing whole grain consumption in Denmark. What is the role, if we go back to the topic of today's discussion, so what is the role of the food and drink industry? When we, in the debate about cardiovascular diseases and cardiovascular health, so the food and drink industry is not a bystander. Over the years in Europe, companies, small and large companies, they have been reformulating product, they have been investing in innovation, product reformulation, research and development to improve the nutritional composition of food and drink products, maintaining at the same time, of course, safety, taste, and also affordability, which is also something that we don't have to forget in our discussion. And innovation is not a side issue, because innovation is one of the tools that we have, and it's very important to improve diets. But innovation cannot happen in a vacuum, because it depends, innovation, on predictable, coherent and science-based policy framework. And this word science-based, evidence-based came many times mentioned by several speakers, the commissioner himself in his keynote speech. So from our perspective, the most effective policies are those that enable and accelerate innovation, rather than policies that unintentionally discourage innovation or undermine it. And here I want to refer, I'm not going to dwell on it because we need a separate event only to discuss this topic, but of course, here the debate around processing and ultra-processed food, it's something that we have to be very careful about already how we frame the public debate, even before going to the, let's say, the discussion about which or if and what policy measures to adopt, because already the public debate is risking creating unintended consequences for innovation in Europe. So what do we need when we talk about like the perfect policy mix? We need a combination of financial incentives. We need removal of regulatory bottlenecks to innovation, better regulation. All of these, they help the industry to deliver healthier options faster and also at a greater scale. So going forward, if Europe wants to strengthen cardiovascular prevention through nutrition, we need a ground decision on robust evidence, also evaluating what has worked and what has not worked. And we have to create the regulatory conditions to allow innovation to be deployed quickly and widely. So just to conclude, of course, the food and drink industry that stands ready to contribute to healthier diets, to continue contribute to healthier diets. And with the right policy and also regulatory environment, we can deliver better health outcomes in cooperation with other partners, public and private, while also at the same time strengthening Europe's competitiveness, also sustainability, and taking into account affordability for consumers. Thank you.
Thank you, Sara, for your intervention. And now I would like to ask João Albuquerque, Director for Advocacy and Political Affairs at Eurocommerce, the Retailers Association.
Thank you very much, Maria-Teresa, and thank you to the Food Forum, Mulțumesc, MEP Voiculescu, for organizing this very important debate. Luckily, I have a lot of time, 4 minutes to speak about a very simple issue, but I will try to be very brief so that we can get to the end of this year of January. I think the food is a very passionate topic for everyone. And of course, every mind has its own opinion on food, and culture influences a lot. And we as retail and wholesale, we are a privileged actor in terms of understanding what are, despite these ideas that individuals have, what are the major trends that we see right now in terms of consumption. And what we acknowledge right now is that there is a specific trend of consumers looking for healthier nutritious foods, whereas at the same time, price still remains a decisive factor in choices of consumers. We play a significant role in terms of providing services for consumers that's inside on the fact that people can choose a healthy lifestyle, just not healthy food. We don't kind of adopt this idea of just going for a healthy food rather than a healthy lifestyle. And I think what we have experienced today shows that it's not a matter of going into that decision, but that people have the awareness, the mechanisms of choice, the education, and the resources to actually be able to make the right choices to have balanced diets. So what I wanted to share with you is our long-standing commitment and firm commitment in terms of providing access to this kind of foods. We play a decisive role in the value chain to provide affordability as well for consumers. We have spoken a lot about this issue as being a decisive factor in many of the consumers' choices, and our sector plays a significant role in terms of providing fresh products, fruit, vegetables, whole grains, and legumes by optimizing supply chains and logistics to keep prices stable and accessible to all income groups. But apart from that, I think that if you all put your hats as consumers, when you go to a supermarket everywhere in Europe, the first product that you see anywhere in all of our stores is immediately fresh produce. And I think this has a decisive impact on how we want to also give and provide the solutions for empowered decisions by consumers. And we are committed to continue with this path. But I also want to highlight that as retailers, we were early adopters of front of pack labeling and continue to push for harmonized science-based consumer information systems. And we support the development of EU nutrients profiles so that claims like low fat or high in fiber remain truthful and not misleading. And of course, we also want to take and are taking responsibility for our marketing, particularly in removing child-targeted advertisements on HFSS. I don't want to go into full extent also because we don't have a lot of time, but I want to leave you with some key recommendations from our sector. And I think what we heard today also from Commissioner Vaheli and the strategy that is being developed is very encouraging for the work and the strategy that we are also following. Subsidize healthy staples rather than tax less healthy goods, as we see can have a more significant impact in terms of consumer behavior and consumer changes. Support voluntary commitments under the EU Code of Conduct and reward reformulation efforts. Develop harmonized science-based food information and complete nutrient profiling work. Avoid restrictive, non-science-based policies on ultra-processed foods. Promote digital and technological tools and apps to help consumers plan balanced diets. Co-develop education and literacy campaigns with retailers, to which we stand very much ready to outroll. Use public procurement, as it was said extensively today, to model healthy eating patterns. Offer healthy and sustainable school meals and integrate nutrition and physical activity in curricula, and ensure that any new measures align with the existing EU framework to avoid fragmentation. I will conclude by saying that retailers and wholesalers are committed partners in improving public health, and that by combining affordability, clear information, reformulation, innovation, and education, we can deliver real progress without unnecessary restrictions or confusion. Together, and I think this is the key word here, as part of the food value chain, we can create an environment where the healthy choice is truly the easy, accessible, and most attractive choices for all Europeans. Thank you.
Thank you, Joao. And then I would like to give the floor to Nadia Fritella, Secretary General of Wine in Moderation Association. Please go ahead.
Thank you very much. Thank you to the organizers, and thank you to MEP Voiculescu for inviting me to contribute to this important discussion. So I'm very pleased to be here today on behalf of Wine in Moderation. And before anything, allow me to explain what wine in moderation is, because even though our name probably gives it away, it's important to straighten out certain things. So wine in moderation is composed by actors that are linked to the wine sector, that are linked to the wine value chain, who work hand in hand towards one simple goal, which is to encourage moderate and responsible drinking and inspire sustainable culture of wine. This means that we work together with wine producers, wine organizations from across the globe, sommeliers, enologists, HoReCa professionals, wine tourism professionals, wine educators, and leading wine companies who believe that enjoying wine should go always hand in hand with moderation, awareness, and respect for the product. One thing that is also important to understand is that we are not a policy organization, but we are actually a program for action. So this means that we develop tools and materials for professionals of the wine value chain. Together, we promote responsible behavior, we share information, and we promote a culture where excessive drinking does not have a place. And we talked about it before earlier in the discussion. Harmful drinking should not be a part of this. And this matters because wine, like food, is part of many Europeans' daily lives, whether it is at home or in restaurants or, in convivial settings, like we all have a dinner tonight, for example. So the way wine is consumed makes a real difference. And we talk here about drinking patterns and patterns of consumption. And this is valid for wine, but it is valid for many other foods as well. People don't make choices in isolation. They drink, they eat, they move, and they socialize in real life situations. And that's exactly how we try to address it at Wine in Moderation as well. We try to focus on real life situations. So this brings me to what we actually do. So our mission has several key dimensions. It is education, it is consumer awareness, it is cultural integration, and multi-stakeholder collaboration. So if we start by education and awareness, well, we run campaigns that target adults to encourage informed choices. And we talked about this earlier as well. It is important to make informed decisions. We provide guidance on what moderation means in practical terms, the social context where wine is traditionally consumed, so around the table, with food, together with water, how to enjoy it responsibly. We also explain who should avoid drinking and situations in which wine should be avoided. Our campaigns are designed to be positive and constructive, helping consumers understand that moderation can be a part of a balanced lifestyle when enjoyed moderately. A good example is our Wine in Moderation Day campaign, which has been running for 3 consecutive years on November 8th, where we say that the greatest wine is the one that you will remember. And I warmly encourage you to take part as well in the upcoming edition that will take place next November. Secondly, as I mentioned before, we work closely with the wider wine value chain, so wine professionals from producers to people working in restaurants and wine tourism. We do so by sharing practical tools with them, such as guidelines and toolkits, practical recommendations on how to integrate messages of moderation at every consumer touchpoint, whether through communication and marketing or on and off premise in wine tourism or directly via the winemakers and the professionals. We help them communicate responsibly, encouraging moderation and responsible experiences, and support balanced choices. Because these are the moments where consumption actually happens and where small changes can actually have a big impact. Thirdly, education. So we actually recently launched a digital responsible service training tool where we aim to equip professionals across the sector with the knowledge and skills to promote moderate and responsible consumption in their daily interactions with consumers. And this training, it's important to note that it is adaptable to the national culture, the national legislation, because obviously everyone consumes wine differently. In conclusion, we try to offer a constructive perspective where we focus on practical tools, cultural awareness, professional and consumer education by working all together with the same goal. We will continue to do that because we believe that prevention is about supporting people to make better choices within their daily lives. And I will also finish by highlighting the fact that one size does not fit all. So our role is to make sure that every choice is informed and responsible. We are committed to being a constructive part of that picture and to encourage moderate and responsible drinking in the frame of a balanced and healthy lifestyle. So thank you very much, and I'm happy to take any questions as well.
Thank you, Nadia. And I would like to give the floor to Andrea Magarini, Director of Food Policy Department at the City of Milan and also Chair of Eurocities Working Group on Food. Andrea, please.
Thank you very much. And we as our European cities and together with our colleagues from Eurocities, we are working a lot on this topic since many years. In our network are working more than 100 European cities that each day are working to implement local urban food policies. And by reaching the goal of a cardiovascular plan, we think that within our local food policies, the main important element are school meals program that all around Europe our cities are implementing since very long time. In Milan, we start our journey with a school meals program in 1900s. In the next slide, you can see a map of our cities and how we spread this kind of program, because each blue dots are canteens where are served each year 220 meals. So for 220 days, we are supporting 1 meals for these children. Nowadays, the program reached 77,000 meals per day, while where 5,000 are free access and the other are targeted by income. So it's also a program that can be also connected to other European strategy, and is very interesting. See also what the European Commission mentioned within the European Child Guarantee, but also tackle some elements regarding nutrition, and that can be very well connected. In order to implement this program, of course, we are exploiting a lot of local procurement. We are working directly with 69 suppliers from raw materials. So we not purchase already well-prepared meals, but we purchase raw materials, and each of these 69 suppliers are arriving throughout a tender, and each tender is tailored by specific criteria. Based on all of this system, we reach a very high number of organic products, local products. 18 suppliers are local, so within the radium that the Italian law defines as local, that are 75 kilometers in our case. And by working also with these local suppliers, we are working to grow also our relation with the market. And by the choices of our menu, also the market are supporting us. And just to share, for a concrete example, in which we are working in Milan, the first is Health by Design, because we do seasonal menu, and all the time in which we change the menu also by engaging parents. Very strong part of our effort is to engage parents in this discussion, not just top down from the municipality and our municipal agency, but working with the parents and the broader community. We are working a lot to changing our menu, and starting from the beginning in our nurseries since 2016, we avoid add sugar and add salts since 2016. And this was very important in the beginning because the parents weren't agree with this policy, but explaining all the reasons at the end, we engage all of them, and starting from the beginning and then moving to the kindergartens. Second, we work a lot on the protein transition. A lot, not only Milan, but all the European cities are working on protein transition, because of course we can achieve the health goals as well, the sustainable one, by transform our proteins within the 5 days of each day in our school menus. And the legume transition is the base of this strategy. For doing this, also we work a lot on food literacy, because it's very important to explain to all the targets of a school meals program the reason why we are changing something. Teachers, parents, chefs are very important to be engaged. So you see throughout the school meals program how the entire city can be engaged in this discourse. Third, as the commissioner presented in the beginning, and we are very, very, very interested on that, the youth school scheme. So the fruit consumption is very, very important important, and all the European cities think that this program needs to be reinforced also in the near future, so to maintain and reinforce this program, because there are some cities, and the case of Milan is one of them, in which we are reinforcing this program by increasing the days of free distribution, and in Milan is daily. And we start again from kindergarten, preschools, primary schools, and secondary schools. So we try to use the habits of fruits as try to accompany these children throughout their journey. And we see that by doing some research that in these classrooms, the fruit consumption is increased plus 75%, because it become an habit at the end. If you serve daily, and also if you accompany this program again with food literacy pathways. For example, is concerning nudging, and in this program we were a very strong alliance with the Commission, because throughout an Horizon project, Food Trails, we reshaping our school meals, our school canteens, and the physical space is very important. We see throughout that research that the contribution of only the physical space, but changing completely the image throughout color, throughout information of the wall, we increase the child appreciation of each meals plus 6%. And in school meals data, 6% are very important, because of course we are working also on very complicated raw materials for children. And if we go to the next slide, we can also see.
Give you 1 more minute, please.
Okay, I conclude. In this slide, you can see 97 cities that are the blue dots, in which each of them have an advanced school meals program. So we are not alone in Milan, of course, but in this slide you can see we use also the data from the Child Guarantee Feasibility Study for implement school meals all around Europe, that was done in 2017. And so by connecting the provision at national level of school meals, of course there are some cases in which there are universal free provision, like Sweden and Finland, for instance, and also the cities are part of this journey. And the reason why it means that the capacity all around Europe exists, and we are very happy for this discussion. Thank you.
Thank you. Thank you, Andrea. And I give the floor to Krystyna Welskowska, Chief Financial Officer at GA Europe. Please go
Thank
ahead.
you. Thank you.
Thank you
for
last
the
speakers,
Yes,
and then we take
yes,
some
I'll
questions.
keep it short. Thank you for the invitation. It's really a great pleasure to be here. I have been just very little provoked, and I have to tell you this because in my previous life, when I was younger, I was a farm girl. So every morning at 4 a.m., I would wake up and I would go to deliver fresh milk. 20 years after, I'm a mother, and I have been raising 2 of my kids with milk that I have been buying 6 liters of milk from the supermarkets. And I know that non-processed milk can go up to 2 days. But the consumer society and our style has changes. So it's, I know this statement probably will be broken down by the scientists and the professors that the milk is equally same quality as it was in the past when we had more of a fresh products and milk. But that's what it is. So we need to just to bear with what we have. But in 20 years, I know that many things have changed. Why I'm here? I'm the financial officer, but I am representing Junior Achievement, which stands for the largest European network and entrepreneurship education. Very proud to say 4 times Nobel Peace Prize nominee for the reason that we are building really resilient mindset and developing critical thinking of young people who are building the future. What we do is we take the 7 million young people across from one per academic year and taking them on a hands-on experience from ideation to bring it to completion. It's a very much hands-on experience. We have been, to be attractive for the students, we had to follow the trends. So we have been working a lot and focus on social inclusion, on STEM, AI, digital. but very proud to say that the food really matters to young people. And this is why I'm here today to speak about it, because as what Eduardo was mentioning, education and going to school and listening to young people, but also working with them, it's great because it's in the interest of young people, the healthy diets and the healthy food. Just I'll present very shortly one initiative. It's called Foodathon. We have been working with young people from Africa and Europe, where they have been mixing and had to come with a sustainable food chain system, and it has been working incredibly great. The winners of this year, we are bringing a joint venture from Mauritius and Lithuania, and we are going to bring them to the biggest startup event in Latvia, organized by JA Europe. It's a moment that we need to provide incentives, but we also need to disseminate the ideas of these young people. Why? Because in the future, they are going to really to contribute to the healthy economy we are building across the education. Young people are the future consumers, are the future workforce, and they are the future startuppers. So a lot of these startups that are coming through the JA programs are very much focused on sustainable food chain, on generative agriculture, and by bringing also a bit of AI, because we need to be there for the young people, because this is what they are using. We have been creating more than 1,500 startups with AI in the generative agriculture. One of the things just I want to mention, and this is called for everyone, that think, and we say, we go to education. This is how we are going to educate young people. It's us. We cannot let everything to be done by the teacher. The teachers are under huge pressure to go, to upgrade, to reskill. The teachers are aging in Europe. So what we are doing, we are bringing more than 90,000 volunteers to go to schools, because this is the only way we can change the mindset. We can listen to young people, but we can help them on shaping up their future. So this is a call for everyone to volunteer, to get back to school and work with the young people, because that really matters. We work a lot in partnerships with big companies. We work with Nestle, we work with EIT Food, we work a lot with the EU, and also with Bayern on really shaping these ideas of young people and bringing them to realization. So the future is there. We just need to give a bit of a push. Thank you so much.
Thank you, Christina. Thanks a lot. And I think we probably have maybe the time for just one question. If there is one question to the entire panel, it would be actually fantastic. If I do have one, but okay, please go ahead. And also appreciate a very, very concise answer, unless your question is to a specific person. Thank you.
Hello, my name is Dragoș Mănescu. I represent the Soviet Association from Romania. Actually, I need to have to address the question, but in order to do that, I need to explain something. So can you please bear 2 minutes? 2 minutes with me? 1 minute, okay. I've heard today very easily mentioned the word taxation as opposed to education. It's very easy to tax. It's hard to educate. So how about we focus on that, and how about we use taxation? And this is my question. How about we switch the focus from taxation to education, and we use taxation as, let's say, one of the last resorts that we have in order to have more healthy people? We have evidence today that sugar is bad, and I think we all agree to that. But I've also seen evidence that wine is bad, all sorts of wine in no matter what quantity. I've seen evidence that fish today is bad, and I see the public opinion that says that today pork is bad, that veal is bad, and tomorrow we see some other evidence saying the other way around. In Romania, things like taxing soft drinks, my industry, for the sugar quantity, it doesn't work. As opposed to other countries, in Romania, only 10 or 12% of the soft drinks that have that do not have sugar are consumed by the Romanian consumers. And yet they have to pay a lot, like 52% more in the last 2 years for the soft drinks. These are the results of taxes. So my question is, can we switch the focus from taxing to education?
I don't know if you would like to answer, because that's maybe the most topical one. And I don't know if there is any other answer. Please, Esteria.
Thank you for your question. And it was very interesting today to hear the stakeholders, to hear different views, because this is very enriching for us to hear what you want, what you argue, in order to formulate our policy choices at European level. At member state level, it is another level. I cannot answer for that. And as I mentioned, taxation is just an arrow in our quiver. It is not a panacea. It is not something that can work alone. So taxation and education, and actually taxation, it is not only taxes on SSBs, on HFSS. Taxation is also giving tax incentives for healthier products. It is also promoting through subsidies physical activity. So there are many ways to design a tax. And for a tax to be efficient, it has to be designed very well. And as I mentioned before, it cannot act alone. It goes hand in hand with other policy measures. Thank you very much.
Thank you. Is there anyone else that want to answer? Adam, I see you smiling. I don't know.
May I contribute to this question?
Yes. Please, Eduardo.
Very shortly, I just would like to give you an example of how taxation could work for the goods. I mean, in many member states, we have a taxation on pesticide, 2-3%, depending on the member states, but make a taxation on pesticide. But what is interesting is some of those member states, this money are channeled into a specific budget, and in our case, is to finance organic research. So the idea is we use the money of pesticide to finance more sustainable agriculture with our research. We could think of something like that as well, where there is taxation on certain category of products, but the results of this taxation are clearly identified to support education, for example, into better food habits. And then you mentioned that taxation is very different. And I would like to remind you that the VAT is a very powerful tool if we want to indicate ways to consume more healthy food. We, as an organic sector, have been asking a study many times to your commissioner about the use of taxation in these regards. This is part of the European Organic Action Plan, which so we hope that this will be delivered soon from your commission, because we do believe that reducing VAT on certain category of products, in our case, especially organic products, could be a way to promote more accessibility to healthy food. Thank you.
Thank you. Yes, then I would like to ask a question as well to Adam.
VAT is very much in my heart because I have worked on that. So I can say to you that since 2021, the taxation, the VAT on basic foodstuffs, fruit and vegetables included, is zero rated at EU level. So member states have the discretion, if they like to, and some have done it, to just not tax, to tax with a zero rate these kind of healthy foods. Thank you.
Thank you. I actually wanted to ask Adam Drunowski, not the author, no, you, Adam, the other one, because I see you on, I don't know if you want to make a comment, I give you 1 more minute, but it was more in relation about the question and the American pyramid, the new American pyramid that I think Adam put on one of the slide. So Adam, do you have a comment or do you want to contribute? Otherwise, I give you the floor to the other Adam.
Very brief comment. I find it a little bit disconcerting that...
Adam, we cannot hear you. Now, can you speak
I'm
again?
unmuted.
Yes, please go ahead.
Okay, so I find it a little bit disconcerting that given the focus on affordable nutrient density, the focus has been on taxation and not on food prices. So where is the European list of national food prices so we can really look at the relationship between diet quality and cost? We have this issue in the United States. We have the new pyramid. What is the cost of eating healthy? And the answer is, we don't know. The Secretary of Agriculture says you can get a meal for $3. Critics say you cannot. There is no national data of food prices beyond 2017. The answer is, we don't know. In Europe, do you know what it costs to eat healthy? I'm not sure. So I think it's kind of important to look at food prices and affordability before looking at taxations and subsidies and so on. What is the price of food and what is the relationship between nutrient density and cost?
Thank you very much. Thanks a lot, Adam. So I would like to maybe bring to a close the conversation. It was very, very interesting. And clearly we can see that there is no one size fits all at all, and then that actually there is a need for a dialogue. So I would like to thank again the European Food Forum and Vlad, MEP Voiculescu, for hosting this session, which is very, very interesting. And we have heard the willingness of everybody to engage and to be part of the, in a sense, conversation and the policy making as well. And with that, I would like to really thank everybody, the speakers that they have contributed. Thank you so much. And also everyone else who has attended online or in presence. Again, thank you to the European Food Forum, to Rezi and Luisella. And I will give the floor to Vlad to close. Thank you very much.
Thank you so much. There was no taxation in the room and no food, but there was lots of education, at least for me. So thank you for that. I think we had lots of good ideas and lots of interesting viewpoints. Generally, any policy is just as good as its support for it and its implementation. Two of them. Looking at the former state secretary of in the Ministry of Finance in Romania, we know what we're talking about. And prevention is obviously slower, but much cheaper than crisis management, whether we're talking about our personal health or our society's health. So I'm looking forward to further discussing and working on these issues together with all of you, with the Commission, with the Council, and I guess we're at the beginning of something very interesting with the launch of the package that the Commissioner presented in just 2 hours ago. The package launched in December. Thank you to all of you, to the speakers, but to each and every one of you for your contributions. Thank you.
Thank you.